Have you ever looked at your nails and thought that that rounder shape, that paler color, or those little ripples were just signs of aging? And that's it. I need to start this conversation with a statement that can shake the structure of what you've always believed. Treating nails as a purely aesthetic issue, hiding them with dark nail polish, or simply accepting that they become brittle over the years is one of the most silent and dangerous omissions anyone can make with their own health. What I'm saying is not a metaphor. The matrix of the nail, that living factory hidden under the cuticle, completely renews itself every 6 to 9 months in the hands and every 12 to 18 months in the feet. During this period of construction, it records, like a biological seismograph, each metabolic oscillation, each nutritional deficiency, and each inflammatory aggression that occurs inside the organism. If your nails are brittle, you've probably tried strengthening foundations, self-bought biotin supplements, or even those homemade garlic and oil recipes. But if fragility persists, and especially if deep grooves or an abnormal curvature have appeared that didn't exist before, your body isn't asking for a keratin boost. He is shouting, silently, that something much deeper is out of balance. There is a specific condition called koilonychia, in which the nails become so thin and concave that they look like small spoons. If you've noticed this, know that this depression in the center of the nail plate is not a whim of age. It's a classic sign that your blood biochemistry is altered, and believe me, the mechanism behind it is something that most quick consultations simply don't have time to investigate in depth. The nail is a translucent tissue that allows us to see the color of the vascular bed below. If the blood is low in oxygen, the nail becomes bluish, cyanotic. If the blood is low in iron, the nail becomes pale and concave. If the blood is loaded with toxins, the nail may become yellowish or thick. Every change in color, texture, and curvature is a letter written by your deep metabolism, a letter that most people throw away without reading. And what brings me here today is the certainty that, if you are over 50 years old, you have already received at least one of these signs and interpreted it as freshness, as genetics, or as an inevitable result of washing dishes without gloves. It is not. Your body is trying to tell you something that can save your life, and I'm going to translate that message now. Now think of the silent dimension of this problem. The heart beats, the lungs inflate, the brain commands, and all of this is a top priority, but its extremities, the tips of the fingers, are the first territory to be sacrificed when the body needs to ration resources. The organism is a ruthless survival machine. For him, keeping the tip of your index finger nourished will never be as vital as maintaining heart muscle or brain oxygenation. Therefore, nails work like the canary in the coal mine. They are the sacrificial fabric. When peripheral microcirculation begins to fail, long before you feel a twinge in your chest or more severe forgetfulness, the capillaries that irrigate the nail bed are already contracting. The visible result is a dull, bluish, or too pale nail, which many attribute to cold or age, but which is actually an early marker of the condition of your vessels. And here, my friends, I plant the central question that will accompany us to the end. How many silent signals has your body emitted through your nails that were ignored because there was no pain? How many times have you looked at a dark spot under your nail and thought it was just an old beat, when in fact it was a vascular effusion that indicates systemic capillary fragility? How many times have you felt the toenail thicken and thought it was the tight shoe, without knowing that it could be the manifestation of a fungus that installed itself because your immunity was low, or, worse, the manifestation of a psoriasis that is also inflaming your joints? The problem is always bigger and quieter than it seems. The nail does not hurt, does not bleed, does not throb like an inflamed tooth. It simply changes slowly over months, and our ability to adapt visually makes us accept the new color, the new texture, the new curvature, as if it were always there. Until one day, a major event happens, a heart attack, a diagnosis of diabetes, kidney failure, and no one looks back and says, wait, 3 years ago, his nails were already different. I'm going to give you 2 concrete promises. The first is that, in the next few minutes, you will understand exactly the physiological mechanism that links the curvature of your nails to the oxygenation of your heart and lungs, a piece of data that can completely change your perception of cardiovascular and pulmonary risk. The second promise is that I will reveal the name of the inflammatory compound that atrophies the nail matrix and that is aggravated by an extremely common eating habit, considered harmless, a habit that many people do daily believing that they are taking care of themselves, but which in reality completely nullifies any attempt to strengthen the nail. Carry these two open questions in mind as we move forward. What does the curvature say about my lungs and heart? And what is this silent poison that sabotages keratin and is present on the breakfast table of millions of Brazilians? To answer this, I need to dive with you into high-level physiology, but with simple and direct words, because what is at stake here is your authority over your own body. Let's start with the scariest and most revealing shape that a nail can take. Digital clubbing, popularly known as nails on watch glass or digital clubbing. When we observe a person with their fingertips enlarged and their nails excessively curved, looking like they have been molded on a sphere, we are not seeing a keratin problem. We are seeing visible proof of chronic hypoxia, that is, a lack of oxygen that lasts for months or years. The mechanism is frighteningly logical. When the lungs lose the ability to oxygenate the blood properly, or when the heart pumps oxygen-poor blood into the systemic circulation, the body reacts by trying to create shortcuts. It releases growth factors, such as platelet growth factor, which stimulate the proliferation of blood vessels and connective tissue in the extremities. It is as if the body, in desperation, tries to increase the oxygen exchange surface at the fingertips, creating a shunt, a circulatory bypass. The fingertip bone literally suffers from mild hypertrophic osteoarthropathy. The angle between the cuticle and the nail plate, which is usually around 160 degrees, disappears. The finger swells, the nail fogs up. This is not a toenail disease. It is a warning sign for congenital heart disease, pulmonary fibrosis, lung cancer, or inflammatory bowel disease. The journal American Family Physician published an extensive review highlighting that clubbing is one of the few clinical signs with high specificity for intrathoracic diseases, and amazingly, it can precede the diagnosis of lung disease by up to 5 years. Think about the dimension of this. 5 years of a visible sign at your fingertips before a diagnosis that could have been earlier. 5 years in which the person could have had a chest CT scan, discovered fibrosis at an early stage, changed habits, treated early. But no. The system looked at the fingernail and saw nothing. Or worse, the patient looked at the nail and thought it was just a different shape, a familiar feature, and didn't investigate. I remember a patient, Mr. Antonio, a 62-year-old man, who came to the office because his wife insisted that his nails were strange. They were curved, shiny, and the fingertips seemed a little swollen. He didn't have shortness of breath, he didn't cough, he didn't feel anything. But the sign was there, shining at your fingertips like a beacon. We asked for a chest CT scan. Early-stage bronchogenic carcinoma, operable, curable. The tumor had not yet given respiratory symptoms, but it was already stealing oxygen from the blood, and his fingertips gave it away. Mr. Antonio is alive to this day, and every time he meets me, he shows his hands and says, "Doctor, my nails saved my life." That's the power of reading the signals. And what scares me is to think about how many Antonios are out there, looking at their curved nails and thinking, that's just the way they grow now. But maybe you don't have your finger on a drumstick. Maybe your nail is turning pale, brittle, and has a depression in the middle, as if someone pressed down on the center with their thumb and left a permanent mark. The first revelation I want to make here, and which seems obvious when I explain it, but is extremely frightening in clinical practice, is about iron deficiency anemia. Koilonychia, that spoon-shaped nail I mentioned, occurs because iron is not just a component of hemoglobin. Iron is an essential cofactor for the enzymes that synthesize keratin. The enzyme lysyl hydroxylase, which hydroxylates lysine to form protein crosslinks, relies on iron. Without iron, the nail matrix produces a defective structural protein, a fragile keratin that does not support normal curvature and becomes depressed in the center. But here's the betrayal of the system. The serum iron dosage that is done in a routine checkup can come back normal. Your doctor can look at the scan, see the ferritin at the lower end, and tell you that it's okay because your hemoglobin hasn't dropped yet. He may look at you and say, "You are not anemic. Your blood count is normal. This must be stress or nail fungus." This is a classic mistake that nullifies early diagnosis. The nail does not wait for anemia to settle in the blood. She suffers first. The nail matrix is so sensitive to iron depletion that the sulcus or depression appears in the latent deficiency phase when the ferritin is already below 30 nanograms per milliliter, but the blood count has not yet shown a drop in hemoglobin. And here's a highly specific detail that acts as a memory anchor. Ferritin below 30 is already capable of causing symptoms such as fatigue, diffuse hair loss, and brittle nails, even with normal hemoglobin. The nail is screaming for iron while the blood test still looks calm. If you have this spoon-shaped nail and you accepted that it was stress or ringworm, you missed the window of opportunity to treat the cause before the debilitating fatigue, before the shortness of breath when climbing stairs, before the skin pallor that others begin to notice. And you know what's crueler? Many women over the age of 50 live with this iron deficiency for years, because after menopause, anemia is less common, and doctors stop investigating iron. But silent loss can come from the gastrointestinal tract, from a polyp that bleeds microscopically, from a chronic gastritis that prevents absorption. The nail denounces the polyp. The nail denounces gastritis. The toenail is the earliest sign that something is stealing iron from your body, and ignoring this sign is giving the problem time to grow. Moving on to an inflammatory scenario, I want to talk about nail psoriasis. Watch this carefully, because many people mistake it for ringworm and spend years applying antifungals that don't solve it, while the actual disease eats away at the joints. Psoriasis is not a skin disease. It is an immune-mediated systemic inflammatory disease. On the nail, it manifests as small punctiform depressions called pittings, as if the nail had been attacked by a sewing needle. Oil stains also appear, a yellowish color under the blade, and onycholysis, which is the detachment of the nail from the bed. The mechanism behind this involves inflammatory cytokines, such as tumor necrosis factor alpha and interleukin-17. These inflammatory molecules attack the place where the nail is being manufactured. The nail grows out already sick. But the most serious thing is that the presence of nail psoriasis is associated with a much higher risk of psoriatic arthritis. The joints are being bitten by the same inflammatory fire that destroys the nail. Every year that you ignore these depressions on the surface of the nail thinking it's fungus, the joint damage progresses silently. It is the nail denouncing silent arthritis. I attended a patient, Mrs. Marlene, 55 years old, who came to show me her nails. They were full of holes, as if they were thimbles. She had already been to 3 dermatologists who prescribed topical and oral antifungals. Nothing solved. She also complained of pain in the knuckles in the morning, but attributed it to rheumatism of age. When we examined the nails with a magnifying glass, we saw the typical depressions and the oil stain on the nail bed. We refer them to the rheumatologist. Confirmed psoriatic arthritis. The immunobiological treatment changed her life. The nails recovered within 6 months. The joint pain disappeared. But she spent years treating her toenail as fungus, while her arthritis advanced. Her nail was crying out for help, and the system kept applying ointment for ringworm. Now I want you to connect deeply with what I'm saying. I'm going to take a break from the whirlwind of data so we can look in the mirror together. Do you remember looking at your hands and seeing smooth pink nails that didn't need special files or miraculous bases? I know that over the years, there can be a tiredness when you wake up, a slight forgetfulness of names, and then you look at your fingertips and see vertical lines, fragility, a different color. It is not about vanity. It is the shock of not recognizing yourself not only in the skin of your face, but in the tools that support you, that hold the cutlery, that button the shirt. Every time a nail breaks abnormally, it's not a character flaw or a sign that you're getting old and useless. It is a micro-trauma that echoes an internal disorder. I say this with respect, not with pity, because the body you have today is not a treacherous adversary. It is a messenger. The message is stuck in your fingertips, waiting to be read. But the good news, and the reason I'm here talking to you, is that science has already deciphered this language, and there is a real way out based on repair mechanisms that do not rely on expensive creams. It's up to you to understand what I'm going to reveal now about the nail factory and how to feed it correctly. Think about your routine. You wake up in the morning, go to the bathroom, wash your face. Your hands are there, in front of you, every day. The nails are there, every day. They are the part of your body that you see the most, after your face, and yet they are the most neglected as a source of information. Science shows us that the nail matrix is one of the fastest proliferating cell tissues in the human body. It competes in speed with the bone marrow and intestinal lining. This means that any interference with energy metabolism appears first in high proliferation tissues. The nail is a direct window into your mitochondria, the power plant of your cells. If the mitochondria are not working well, either due to lack of nutrients or excess toxins, The nail is the first tissue to show. It becomes weak, brittle, with lines, with spots. But the pharmaceutical and cosmetic industry would rather you believe that the problem is on the surface, not the depth. Because strengthening foundation is sold in pharmacies. Heavy metal chelator does not. Nail polish with vitamins is sold in supermarkets. Investigation of silent celiac disease does not. And so, you spend years painting the symptoms while the root cause spreads. And while we're at that point in the conversation, I want to pause for a gesture of community. Anyone who is watching it right now and feels touched by this information, take a second and subscribe to this channel. This is not an empty marketing request. It is an act of belonging. We are building a space of autonomy here, where science is translated honestly and without easy profit. Leave your city or country in the comments and tell me, what is the sign that worries you the most about your nails? The fragility, the lines, or the curvature? I read every comment as if it were a medical record of a patient sitting in front of me, because their experience may be the key to me bringing the next deep dive. And if you can, share it with someone you love and who has been ignoring their nails for years. Sometimes, a video sent at the right time is worth more than 10 queries. Going back to our anatomy, we need to talk about a common mistake that completely nullifies any benefit you try to bring to the health of your nails. Most people, when they see a weak nail, look for biotin supplements. Biotin, or vitamin B7, is indeed an essential cofactor for keratin synthesis. It participates in carboxylase, an enzyme that fixes carbon in structural proteins. Studies, such as the one published in the Journal of Drugs and Dermatology in 2017, show that biotin supplementation can improve the thickness of the nail plate. But here's the benefit-canceling mistake that no one explains at the pharmacy. Biotin is absorbed and transported into cells by a specific transporter, the sodium-dependent multivitamin transporter, and that transporter is shared with alpha-lipoic acid and pantothenic acid. If you take a complex vitamin supplement along with biotin, often competition in intestinal receptors and cellular transporters prevents the optimal dose of biotin from reaching the nail matrix. It's like trying to get on a crowded bus. If you put biotin together with other B vitamins, it may not get a seat on the carrier and be eliminated in the stool without ever having entered the cell. In addition, keratin is not only made of biotin. It needs an architecture of sulfur amino acids, especially cysteine and methionine. Without sulfur, there are no disulfide bonds. And without disulfide bonds, keratin has no mechanical strength. It's like trying to build a brick wall without cement. You can have millions of bricks of biotin, but if your diet is low in high-value proteins, or if your digestion isn't breaking down those proteins into amino acids due to a lack of stomach acidity, your nails will keep chipping. I attended a lady, Mrs. Celeste, 68 years old, who had been taking biotin for 2 years. The nails looked like wet paper. She bought the best biotin from the pharmacy, imported, expensive. He spent a small fortune on supplements. When we investigated, she had hypochlorhydria, low acid production in her stomach, and did not absorb amino acids from her diet. She ate meat, eggs, fish, but her stomach didn't break down proteins into amino acids. The sulfur amino acids did not reach the blood. Biotin was there, circulating, but without the raw material of amino acids, the nail factory could not produce quality keratin. She spent money on the right supplement, but the digestive process nullified everything. Corrected digestion with simple adjustments in food, and at the time of meals, in 6 months the nails were smooth, strong, and she no longer needed imported biotin. The connection to real life here is immense. How many people do you know who have been taking supplements for years and don't see results? The fault is not in the supplement, it is in the field. The digestive terrain, the inflammatory terrain, the hormonal terrain. The nail only improves when the ground is fertile, and for that, we need to understand what is sabotaging the terrain. The second progressive revelation that I want to bring in is about the horizontal and vertical lines. Vertical lines, so-called stretch marks or longitudinal wrinkles, are often accepted as inevitable, and in fact, with age, the nail matrix suffers a slight atrophy, like a printer that loses ink, but when they're too deep and early, we're looking at a deficit of blood flow at the fingertip. Microcirculation is being impaired, and what harms peripheral microcirculation more aggressively and quietly than most imagine? Sugar, advanced glycation, a process in which sugar sticks to proteins, stiffens the vessels. But the common mistake that defeats the attempt to improve circulation is the excessive consumption of omega-6, the refined vegetable oil present in cookies, fried foods, and margarines. Omega-6, in excess, and without the counterpart of omega-3, generates inflammatory mediators called eicosanoids. These substances cause vasoconstriction in the thinner capillaries. The result is that you can drink green tea and eat garlic. But if your intake of soybean and corn oil is high, the inflammation keeps the capillaries closed. The nail does not receive oxygen. The line deepens. Here's the connection to real life. When this microcirculation closes, the first thing that changes is the temperature of the fingers. Then, the color of the nail, which becomes more purplish. Then, the texture, which becomes rigid and brittle. This happens years before a major clog. It is the heart warning that the periphery is being suffocated. Think about the dimension of this. You don't feel pain, you just feel an ugly nail. But it's cardiovascular disease giving you a sign. And here's a highly specific detail that acts as a memory anchor. The ratio of omega-6 to omega-3 in the modern Brazilian diet is approximately 20:1. The ideal, according to science, would be 4:1 or even 2:1. This imbalance maintains a low-grade inflammatory state that reaches the most distant capillaries first, such as those in the nail bed. The nail becomes dull and striated. And what do people do? They buy a smoothing foundation which gives an artificial shine and smooths the surface, but does not open the capillaries. The nail continues to be produced defectively, but now it is made up. The base hides the signal. The disease advances. Now I need to talk about a process that many people over the age of 50 experience and do not associate with nails: chronic dehydration of the nail plate. The nail is made up of approximately 18% water. This water does not come from outside, from applying cream or dipping your hand in water. This water comes from within, from the nail bed, and is regulated by lipids that seal the nail cells, especially the ceramides. With age, the production of lipids from the nail matrix decreases, but the common mistake is to try to solve this with cuticle removers and external moisturizers that contain alcohol or acetone. Acetone dehydrates the blade, removes natural lipids, and the nail becomes brittle and dry. The actual physiological mechanism is that nail ceramides are synthesized from essential fatty acids. If the diet is low in good fats, such as those in extra virgin olive oil, avocados, and cold water fish, the nail cannot produce enough ceramides to retain water. The water evaporates through the blade, and the nail becomes brittle. But what does the industry sell? Formaldehyde strengthening nail polishes, which artificially harden the nail but make it too rigid, prone to breaking at the base. The nail hardens, but it becomes dry. It breaks whole, instead of chipping at the tip. And what's worse is that many of these strengtheners contain formaldehyde, which is a sensitizer and can cause contact dermatitis and bed nail detachment. In other words, the solution sold creates a new problem. The connection to real life is clear. How many times have you applied a strengthening foundation, the nail became hard, and a few days later it broke entirely, close to the flesh, causing pain and bleeding? This happens because the nail has been dehydrated on the inside and stiffened on the outside. The real solution is to nourish from the inside out, with essential fatty acids and enough water. Systemic hydration, that is, drinking water, is essential. But it's not just about drinking water. It is necessary for the water to reach the nail bed, and for that, the microcirculation needs to be working. And for microcirculation to work, the capillaries need to be relaxed. And for the capillaries to relax, nitric oxide needs to be produced by endothelial cells. And for nitric oxide to be produced, you need arginine and an enzyme called nitric oxide synthase. And do you know what inhibits this enzyme? Oxidative stress. And do you know what causes oxidative stress? Refined sugar, excess omega-6, cigarettes, excessive alcohol. Everything is connected. Dry toenail may be the reflection of a vascular endothelium that is not producing enough nitric oxide. And the dysfunctional endothelium is the precursor to hypertension, heart attack, and stroke. A dry and brittle nail, my friends, may be the first sign that the health of your blood vessels is compromised. That's what no one tells. This is what the 15-minute consultation will never have time to explain. Now, I need to talk about a traitor that is on the table of many people who believe they are taking care of themselves, natural fruit juice taken on an empty stomach. It changes everything you think about health. Fructose, when ingested in large quantities and without the fiber in the fruit, goes straight to the liver. There, it stimulates a pathway called new lipogenesis, the formation of new fat. This increases triglycerides. But what do triglycerides have to do with nails? Everything. Hypertriglyceridemia makes the blood more viscous, making it difficult to pass through the thinner capillaries of the nail bed. In addition, fructose increases uric acid. Elevated uric acid, even without clinical gout, is a powerful oxidant that damages the endothelium, the inner wall of the vessels. The capillaries of the nail bed are so sensitive that they suffer constant microlesions. The nail, which depends on these capillaries to nourish itself, begins to grow with defects in color and resistance. The person thinks they are doing something healthy by drinking a detox juice, but they are actually creating a biochemical environment that suffocates the nail factory. That is the silent enemy, my friends. It is not the disease itself. It is the seemingly healthy habit that perpetuates the damage. And here's a highly specific detail. A glass of orange juice made with 3 or 4 oranges contains about 20 to 25 grams of fructose, without any fiber to slow absorption. This causes an insulin spike and a uric acid spike. If you do this every day on an empty stomach, you are, over the course of months, damaging the capillaries of your fingertips. The nail becomes fragile. The person does not associate. She thinks, but I eat fruit. I take care of myself. And the fasting juice is there, silently sabotaging the keratin in your fingers. And what's worse, the juice industry sells the idea that natural juice is health. But physiology shows that without fiber, fructose is metabolized as a slow poison to the liver and vessels. And since we're talking about uric acid and metabolism, let's get to the most surprising mechanism, the one I always save for last. Subclinical hypothyroidism. Nails are extremely dependent on the thyroid hormone T3 to maintain the rate of cell turnover. When the thyroid is slow, even if the TSH tests are still within what the laboratory calls normality, the nail is already screaming. It becomes thick but fragile, with an uneven surface and slow growth. The actual physiological mechanism is as follows. T3 enters the keratinocytes and binds to the nuclear receptor, activating the transcription of genes that produce the structural proteins of the nail. Without T3, the cell cycle slows down. The nail becomes dehydrated and opaque. But here's the common mistake that nullifies any treatment: using synthetic thyroid hormone, levothyroxine, without guaranteeing the cofactors for the conversion of T4 into T3. T4 is the inactive hormone that you take in the pill. For it to become active T3 in the periphery, you need selenium and zinc. If you take thyroid medicine but are deficient in selenium, the hormone does not convert. The nail does not recover. And most Brazilian soils are poor in selenium. The participant in a study published in Biological Trace Element Research demonstrated that selenium supplementation improved nail structure in thyroiditis patients. What does this change in your life? Imagine waking up and, when you run your hand over the quilt, feeling your fingertips smooth, strong, without the feeling that the nail is going to bend backwards. This means that your metabolism is working. I attended a patient, Mrs. Elza, 71 years old, who complained that her nails did not grow. She cut it once a month, and you could barely see the difference. The nails were thick, yellowish, and peeled off in layers. She had already undergone treatment for fungi with no result. When we examined the thyroid, the TSH was at 5.8 within the laboratory's reference value, which went up to 6. But her fingernail said that was not normal. We started treatment with low-dose levothyroxine and adjusted the intake of selenium and zinc. Within 4 months, her nails began to grow. Within 8 months, they were smooth and pink. She said she didn't remember having nails like this since her youth. Subclinical hypothyroidism was there, hidden behind a normal high TSH, and the nail was the only visible witness. And here we come to the climax of our conversation, the most amazing mechanism that connects your fingertip to your brain. The nail is not just a shield. It is an extension of the peripheral nervous system. There is a condition called brittle nail syndrome, but what few know is that it can be an early marker of peripheral neuropathy. A lack of B vitamins, especially B12, B1, and B6, causes degeneration of the myelin sheath. The same nerves that carry the motor stimulus to the muscles carry the trophic stimulus to the skin and appendages. Without adequate nerve stimulation, the nail matrix atrophies. The most recent and alarming study, published in the Journal of the Peripheral Nervous System, linked idiopathic nail fragility to suboptimal vitamin B12 levels, even in the absence of megaloblastic anemia. But the traitor here, the food that sabotages everything, is the excess of refined carbohydrates, which consumes the stores of thiamine, the B1, in the process of metabolizing glucose. That is, the person eats white bread, biscuits, water, and salt, thinking it is light, and is stealing from the body the vitamin that maintains the structure of the nail. The cellular process is a scene of ruin. Imagine the mitochondria inside the nerve axon, trying to generate energy without B1. They fail. The nerve stops sending maintenance impulses. The keratinocyte becomes unguided and produces a disorganized protein. The nail breaks at the tip, just like a dry twig. And what is more alarming, peripheral neuropathy that begins at the tips of the fingers and toes is the same process that, years later, can evolve into loss of sensation, burning, tingling, and, in the most severe cases, wounds that do not heal. The brittle and brittle nail can be the prologue to a much darker chapter. And B12 deficiency is extremely common in people over 50 because gastric acid production decreases, and the intrinsic factor needed to absorb B12 also decreases. In addition, the long-term use of drugs such as omeprazole, pantoprazole, and other proton pump inhibitors, so common to treat gastritis and reflux, blocks the absorption of B12. The person takes the medicine for the stomach, and without realizing it, he is creating a neurological deficiency that manifests itself in the nails before manifesting itself in the nerves. This is a vicious cycle that the health system rarely connects. My friends, pay attention now. We went from the heart to the brain, passing through the lungs, intestines, thyroid, and peripheral nervous system. Your nails don't lie. They are a medical record exposed to the world. But the system treats the symptom, not the cause. In a 15-minute consultation, the doctor looks at the computer, not at your fingernails. The industry profits from its insecurity, selling empowering bases that paint the surface, while the interior continues to burn. You now know that. You left here with the knowledge that the curvature of your nails can indicate lung or heart failure years before diagnosis. That depression in spooning is the silent cry of the iron stock. That lines are the scar of inflammation or lack of oxygen. That natural juice on an empty stomach may be stealing the strength from your hands. That a lack of vitamin B12 may be erasing the neurological command that makes your keratin. That a sluggish thyroid may be paralyzing the growth of your nails even with normal exams. That the excess of omega-6 may be closing the capillaries that nourish the nail factory. This is not about fear. It's about the possibility of anticipating. It's about looking at your hands tomorrow morning and, instead of feeling frustration or resignation, feeling power. Power to read the map that your body is drawing for you. Power to ask the right questions at the next appointment. Power to adjust the route before silent damage becomes an irreversible disease. Every week that passes without this information is a week of silent damage accumulating in your capillaries, in your nail matrix, in your myelin sheath. I want to speak directly to you who have come this far. The person who did everything right and didn't get better. The one he accepted as inevitable. The one who is afraid of becoming a burden. The one who has already spent money on expensive nail polishes, miracle foundations, supplements that didn't work. I tell you with the authority of decades of practice, but with the warmth of someone who knows the value of autonomy. Every morning, when you look at your hands, you will see a map, and this map will give you the power to act. You don't need expensive products. You need to look at the iron, take care of the thyroid, silence inflammation with good fats, abandon the false feeling that fasting fruit juice is harmless, and demand from your doctor an investigation that goes beyond the blood count. Ask about your ferritin. Ask about your TSH and your antithyroid antibodies. Ask about your vitamin B12 and your methylmalonic acid. Ask about the health of your capillaries. Your nails have already asked the questions. Now you have the knowledge to translate them. The content I brought here is educational and complements, never replaces, the consultation with your doctor. But it empowers you to ask the right questions, not to leave the office with an antifungal prescription when the problem is inflammatory, not to accept a normal exam when your body is showing the opposite. I end by asking you to share this video not as an act of marketing, but as a gesture of care. Think about the one you love, who has fragile nails and cold fingers, and who has no idea what that really means. Think of your sister, your brother, your partner, Your neighbor who always complains that his nails don't grow. Send it to that person. Maybe it's the signal she needs to figure out that the body has been talking for years. And now, finally, she has a translator. Nails are the window to the soul, said an old teacher of mine, playing with the popular saying. But not of the soul, my friends. Nails are the window of your metabolism. Open that window, let the light of science in, and never again look at their hands with indifference.